Well, hello. Today, my guest is Martin Williams, and he's Chief of Surgery at a local hospital. My name is Sheila Wilson. I am a registered nurse, president of Stop Healthcare Violence, and we are a nonprofit group. I am also a host on Passionate World Talk Radio with Lillian Caldwell, who is the CEO, and Jeannie White, who is the station manager. My show is called Stop Healthcare Violence, and we have a website, and we also have a Facebook page called Stop Healthcare Violence and Heal the Healer. So Dr. Marty Williams is also noted for his work and advocacy for quality health care for all. The disclaimer of this show is that the views of the guest may not represent the views of the host of the station. Dr. Martin Williams, how are you?
I'm doing well, Sheila. How are you doing today?
I'm doing great. Tell me a little bit more for the audience about yourself and what you would really like to talk about.
I'm a physician. I started medical school in 1978, quite a while ago, and I finished in 1982. After that, I did a residency where I did training in internal medicine. I did that for 3 years, so that was from 1982 to 1985. Around 1991, I decided to switch out of community internal medicine, and I did a residency in general surgery. So I have my boards both in surgery and in medicine. When I was still a resident, I was involved in local community health projects. Probably the one that I was most closely aligned to was a medical van that would go to two different areas in areas of Boston that had a large number of drug addicts. So I would go to the Eggleston Square area with a group of two other people, and then we would then go to the off of Humboldt Avenue, and there I would just do my medical treatments of various problems. But although it was probably more towards complications of intravenous drug abuse, there's some people that would come on the van that had other things like hypertension or STDs, sexually transmitted diseases. When I was, the van was for those Monday afternoons. It was part of a health outreach project at my church. It's called St. Mary the Angels Church. And at that time, Father Jack Wilson was the driver and also the one that that had permission to borrow the van on Mondays. And usually we'd have one other person on the van. So it'd be three people, Father Jack, probably another parishioner, someone else he would corral, and then myself. And then we would spend about 3 hours, an hour and a half at each place. What I wanted to... Okay, go on.
No, that's fantastic. If more people could volunteer and do everything like that, maybe we could cut the numbers down. But go ahead, I interrupted you.
No problem. So I did that for about 11 years. What I want to talk to you about is that Father Jack Rusin, who was the pastor of the church, he got a phone call about a incoming Harvard medical student who did not have housing in the Boston area. And Father Jack offered a room in our rectory to go and house this medical student. As it is, it was Paul Farmer who became internationally known for his work with the poor and with people that were having various medical problems, especially multi-drug resistant tuberculosis, AIDS, cholera, and also Ebola, among other things. So I met Paul probably 2 weeks before he started medical school, and he was living at the church where I would go to church nearly every week. So I had a lot of interactions with him over many years, especially while he was in medical school. I think that probably I got, for lack of better terms, my formation in working with the health underserved through Father Jack Rusin, who had a way of attracting people whom he could talk into helping to take care of the poor and the underserved. So for me, my emphasis was locally based, and Paul Farmer had already spent a year in Conge, Haiti, so his basis is always international. And he, with several other people, ended up founding Partners in Health. Now, what people don't talk about is that Father Jack Rusin played a major, if not the critical role in starting Partners of Health. But because he died quite a while ago, he's kind of lost in history, so he doesn't get the credit for what he did. He's the one who got Paul and Mr. White together to go and help start Partners in Health with Jim Kim and Ophelia Dahl. So with Father Jack, he would always have a variety of priests from really around the world would come and visit the rectory, and through this they would have interesting discussions about pretty much underserved people around the world.
You're breaking up a little bit.
I'm sorry, Jack was fluent in at least 4 languages, if not 5 languages. And they had a natural ability, which is quickly. And Father Jack was probably fluent in another 3 languages. Pretty much will keep up with his brother. So for me to continue on, I'll say that Paul Farmer was also able to learn languages rather quickly, and he was fluent both in Haitian Creole and in French, and also learned was fairly good in Spanish, and then he was trying to learn some African languages, but especially in Rwanda. But I don't know if he ever became fluent doing that.
Wow.
So with Paul, when I met Paul, his girlfriend at that time was Ophelia Dahl, and obviously she came against a and so she could go. And they were very close for many years, and eventually they went their own way. and then Paul married his wife. Private supporters of the early Tom was successful in construction, and it was his plan to give away all of his money before he passed on. So he gave some to his family, and then the rest he gave to society, to people that needed money. He was an amazing philanthropist.
Wow.
Now when Paul, what I would like people to know is that, Paul kind of, entered the world as far as everyone known about him when a book was written about him called, I think, Mountain Beyond Mountains. But what I want everyone to understand is that Paul evolved into becoming, the great Paul Farmer. So, when I first met him, he had years. He was, in his early 20s, so he was really developing what he would become. And there were people that nurtured Paul for him to accomplish. When I met him, he wasn't a finished product by any means, but he's always working on improving himself. And then he always had a passion to help people that were impoverished and also people with very difficult medical diseases. And that's why he spent so much time helping people with before. When I think about the interaction we had, I'll speak to a couple of them. One is tuberculosis. So Paul obviously would use whatever precautions were necessary for patients with tuberculosis. He worked with patients that had multiple drug-resistant tuberculosis. So these are diseases where it takes various cocktails of antibiotics as well as a lot of time to go and rid them of their tuberculosis. And Paul worked with these patients for quite some time. I remember when, after doing this for probably more than 20 years, he grabbed me and told me that he finally caught tuberculosis. And he was surprised because he thought almost that he was immune to it because he'd been around it for probably 2 decades by that time. But that finally his test for tuberculosis turned positive. This Father Jack Grusin, as a matter of fact, died of multiple drug-resistant tuberculosis when he was doing work in Peru. The Father Jack Grusin had moved from our parish and joined the St. James Society, and he went to Peru to work on some health projects, really with Paul. Paul and Jack started a pharmacy and also a health clinic in Peru, and that's when Father Jack developed multiple drug-resistant tuberculosis and had to return to the United States, and he died here from that.
Wow.
Yeah.
It just sounds like this Dr. Paul Farmer was absolutely amazing, but he was able to become maybe what he really wanted to become because he had all the support.
Yes, I would.
Church.
Yes. Yeah, no, that's exactly right. And that's what I was trying to say, that he to the underserved, that with their conversations and their both leaders, he was able to develop into what he'd become.
Dr. Williams, are you still there?
You can't hear?
Okay.
Sheila, can you hear me?
Yeah, now I can hear you.
So it's better known as a photographic memory. So he could read something and have complete comprehension of it immediately. And that allowed him to start Partners of Health while he was in medical school. Additionally, I first figured that out when he was flying during the medical school, I think first year, to London to see Ophelia Dahl. And I told Paul, I said, in med school, you really got to spend some time hitting the books. And Paul, basically said that, he had it covered. And then what I quickly found out was that he had this photographic memory, so he really didn't have to spend as much time as pretty much everyone else did, studying. Usually at Harvard Medical School, there were probably about 3 or 4 people there that had such intellects, and in Paul's year, he was one.
Wow.
But with that, he used it to, to help society, rather than, just using it to enrich himself. Paul later on, when he was working on patients with AIDS, at that time in the early 80s, there wasn't a lot that you could do for patients that had AIDS. And later on, he helped convince drug companies to make or to allow generic treatments for AIDS to be given to the so-called developing companies. And a lot of times people thought that was that's pretty much a waste of time, that the people in impoverished countries, even if they got the medications, they wouldn't take them, they wouldn't do this or that. And Paul was able to create a level of support around his patients so that they would get their medicine and that they would survive and be able to help their families as best as they could financially. Now, that being said, when I first met Paul, and he was trying to get medications for his patients in Haiti at that time, where HIV was had hit that community quite hard. With my job, I would get a lot of so-called drug samples from various drug representatives, because I worked probably the poorest census tract in Boston. So a lot of people had a lot of need for medications, especially diabetic medications. And when I would give Paul boxes of some of the new things that had come out that the reps had left me, Paul, I can recall distinctly stating he did not want to take the diabetic medicines back to Haiti because everyone he knew with diabetes in Haiti died. And I told him, no, you got to take these. Even if you could get them a few weeks or a few months, it might help them. Later on, his thoughts evolved from that to where he would sometimes sacrifice a lot of resources of Partners of Health just to help one client. other thing that I would say about Paul is that, because we've known each other for quite a while, he would, when I decided to leave internal medicine, become a surgeon, he, on more than one occasion, would say that he wished that he could have been a surgeon because it could have helped him more with his patients in various areas, because sometimes patients would need surgical procedures in order to alleviate their suffering. Particularly, I think he was talking about some of the abscesses that develop in patients with tuberculosis, and also at that time with HIV. But I think as Paul would practice in these developing countries, he eventually would do, kind of bedside surgical procedures such as incision and drainage, and I think some biopsies, since there was no one else available. With that, he was proud of the fact that he was able to early on hire for partners and help some surgeons from Cuba for a reasonable amount of money, so then his patients could get the surgical care that they needed. And he had a lot of respect for these Cuban doctors, these Cuban surgeons. I'm trying to think of some more things I can talk to you about. Paul, when they were going to write the book about mountains beyond mountains, he was very excited about it and told me about it. And if I read between the lines, he really wanted me to read it so I would know more about his upbringing. Because although we had talked for many hours, he really never discussed his upbringing at all, to any large extent, except to state that his father was different from other people. I think if you read the book, you can see how the father was kind of almost obsessed with being a little bit different and going off in his own way. And I think Paul got that directly from his father. He was he went all the way with every fiber of his body to go and help the impoverished and medically underserved. He once I went to a golf school in Florida. I told him I had been there. I told him where I was, and he told me that he had essentially grown up, just a few miles from there. I'd known that he had lived in Florida, but I really wasn't exactly. I did not know the circumstances that he was in until I read the book. One thing about Paul that's when you read about him, they talk about him being born in North Adams, Massachusetts. But I tell you, Paul told me directly that he considered himself to be from Williamstown, Massachusetts. So even though he was born in the hospital in that area, which was in North Adams, he said that he considered Williamstown to be his hometown, and to his family, his father took them down south. Let's see. When I first, while Paul was becoming Paul, he could be in his own way kind of forceful in his speech. He would not have a lot of patience to people that were not kind to patients in poverty. And he would say things without couching them in other terms. Years later, probably in the early 2000s, I went to hear Paul talk, and at this time, Paul was as you would say, very political in what he said. He wasn't as forceful and condemning of people that did not have the same appreciation for patients in poverty as he did. And I was kind of amazed, but then he'd grown up. He was now in his 40s rather than his 20s, and he realized that for him to continue Partners in Health, he needed donations from a wide variety of people, and they wouldn't take kindly to the way that he was speaking when he was in his 20s. That being said, Tom, White understood Paul quite well, and obviously Father Jack, and then of course Ophelia Dahl. But for the organization to grow, they had to have more donations than from Tom and from Ophelia. So for him then to give speeches to get more money, he had to be more political in what he said. I think, let's see, I can recall when he first started going out to try to talk people into giving money to Partners in Health, he was quite nervous. So we had talks about that. So I gave him some samples of a beta blocker to calm his heart down so that he could do his public speaking. But Paul's a quick study. Within 6 months, he no longer needed a beta blocker to go and talk and ask people for money. But at the beginning, it really was not that easy to him, and he was, sweating, and he just couldn't. He said that he had problems getting his point across. But with the beta blockers, it helped him steady his heart, so then he could go and get his point across better. But within 6 months, he didn't need that anymore.
Wow.
Let's see. Yeah. Paul loved his family, and he would, talk to me about his brother that played football in Florida, who later became a wrestler. And but Paul, to my knowledge, had no athletic ability. But obviously his brother had tremendous athletic ability to be able to be a professional wrestler and entertainer, as well as to have played college football down in Florida.
Wow.
He was always proud of his mother.
Sounds great.
Yeah, he was always very proud of his mother, and she got a college degree later in life, and he was so proud of that. He, I think that the way life was, although he said that she was brilliant, that she didn't have the opportunity to go to college earlier on. She was sacrificing for the family, and also, dealing with Paul's father, who was eccentric to say the least. Paul would talk to me about his death. So we had too many conversations about that. And Paul, again, I haven't researched all this, but this to me is that he thought he was going to die of heart disease by his late 40s. So this is about when Paul was when he was like 45. Whenever we would talk, he would say, Marty, I don't have much more time to go. And I would tell him, Paul, you don't know how long you're going to be in this world. You've kept your weight down. You don't smoke. You just don't know how long. So his father had died in his 40s. And Paul told me that his grandfather died in his 40s. So that's why Paul was pretty certain that he was going to die in his 40s. So when he turned 50 or so, I said, "See, you didn't die in your 40s. You don't know when you're going to die. Just live life as best as you can." And as you all know, he ended up dying when he was 62 in his sleep just a few months ago. So when I heard word that Paul had died, surprising to me, because he really thought that he was past 50, and he made 60. Other people didn't know. Paul didn't know that when he had died when he was 62. I watched his funeral mass at Trinity Church in Boston on TV, and I heard all the accolades. As I said, it didn't surprise me. He died in his sleep at 62. That's kind of the way that he had kind of thought or dreamed. Just thought it was going to be earlier than that. That I think is a little spooky is that I think he died on a Monday. But when I was in church on Sunday, I'd looked behind me, and I'll swear I saw Paul sitting in one of the pews where he normally sat. And then I turned around, and a few minutes later I looked back, and he wasn't there. So I didn't know what that was about. But I told my wife, I said, I thought I saw Paul in church today, but then I turned around and he was gone. So, but this is like the day before he died.
The day before he died? Was it the day before he died?
Yeah, this is the day before he died. Almost 24 hours exactly, as I recall. In the Catholic Church, there are saints that have been told that they were able to bilocate, and I always wondered if that was part of, that maybe Paul for that day. I don't know. That being said, I think that Paul lived a saintly life, and he really pretty much all of his efforts to help the suffering of the poor. That's all his life was, and I think with that being said, he was still able to raise a family, but Paul was frequently away from the family while he was helping with all sorts of problems around the world. He was in Russia with the multiple drug-resistant TB, as well as when he was in Peru with HIV in Haiti, with Ebola in Africa. And then Partners in Health did quite a bit with the with giving assistance with COVID-19 when it first started. I think as far as when they were still trying to alert people that might have been all but I'm certain that after I hang up, I'll say I should talk about this. Sheila, do you have questions you might want to ask me about Paul that I might be able to help you about?
Well, listening to everything that you have said, he just sounds like an amazing man that was able to accomplish, like I said before, with a lot of support. And he has done miraculous work. I wish we had more men out there, or women, that are able to do that. Now, if I can remember, Dr. Williams, you've done more than going on the van. And are you still doing your work to help in the poor?
Yes, just in my way, with my practice, I do that, but I really don't self-reflect upon it that much. I just kind of do what I think is right all the time. But there are quite a few people out there that think it's a waste of time, it's a waste of effort, and but I just keep on doing what I need to do to try to help alleviate the or improve the health care of people that are really meshed in poverty and drug addiction and mental illness. So that's I've pretty much done my whole career my own way.
Right.
But clearly I didn't have Paul's tools as far as writing over 100 scholarly articles and writing books and being able to read a book and absorb it in an evening, and then to be able to ask wealthy philanthropists for money. Those are all the things that Paul could do and I clearly cannot do. But Paul had all those gifts, and it showed with what he's been able to do. And,
well, he's a man that was given these gifts, and he used them. A lot of people might not have used it. Not to the good that he has done.
Oh no! Like I said, I've been privileged to have met multiple people with Paul's intellect. But few of them to help out the lives of people who are poor and impoverished from developing countries. They use it more to advance their their scholarship and their career.
You're quiet again. So
I'm sorry,
Dr. Williams.
Yeah. So Paul was. Paul became a professor in medicine, and he had his own division at Partners. It was called Partners then, but at Brigham Women's Hospital for international health care. There were when after Paul died, there were they had the big funeral for him. They had the big memorial service for him at Trinity Church in Boston. But at my church, we had a memorial for Paul, and we had quite a few of the fellows. So Partners in Health fellows came there, and I spoke. Other people at the church who'd known Paul from the early '80s also spoke. But then we had people there from really all around the world that were fellows of his in international health who would go and talk about their Paul Farmer stories, and it was kind of good to hear that Paul really had continued on with that for his whole career, and was still and he was, even though he had become internationally known. I recall one of the fellows talking about how Paul had helped him with a difficult clinical problem in Sierra Leone where no one else could figure out what was going on with the patient. And here's Paul was, he was so bright, he was able to figure out the person's illness and how to cure them, whereas no one else could.
Unbelievable.
Mm-hmm.
Is there anything else that you would like to say about Dr. Farmer?
No, I think that's about all I need to say, Sheila. Like I said, I could talk for probably 10 hours, but I think these 45 minutes are enough, though. I think these 45 minutes are enough.
Okay, then I'm going to stop the interview right now and just hang on, okay?
Okay.
Thank you all for listening, and hopefully Dr. Williams will be back with another story.